I had my blood tested and it was positive for celiac disease, but I don't seem to have any symptoms when I eat gluten. Is it possible to test positive but not have the disease? Might the disease still develop later? Is there anything that can be done to prevent it?
This is an interesting question. A positive test for celiac disease usually indicates the possibility of celiac disease, and that's why we always encourage the biopsy in order to confirm the diagnosis. There could be exceptions. In some cases, a skilled physician knowledgeable in celiac disease may decide not to do the biopsy, relying only on the test, but that's really the exception. The rule remains that the biopsy is needed to show that a positive blood test really implied celiac disease. So the biopsy is the one step that I would strongly recommend in order to rule celiac disease in or out. It is certainly possible to have a positive test and not being celiac. And that's why we say that the specificity of the test is about 97% or so. 97% specificity means that 3 individuals out of 100 at large that do not have celiac disease will be positive for a test. So that may be your case, and that may be why you have no symptoms. If the test is highly positive, if the level of the blood work of the antibodies is really high, the chances of this not being celiac are actually not that many. Hence, the biopsy really would be needed. If the blood test is only borderline positive, then that's more likely to be a false positive, one of those 3% that we know will be having a positive test, not having celiac disease.